The study of anatomy requires learning a new language. There are a number of new terms to become familiar with. We're going to start with the directional terms, which are used to describe the position of structures in the body relative to one another. You'll find a diagram on the website which I suggest that you annotate during this video presentation. The starting point for these directional terms is always the anatomical position, which is defined as somebody standing upright, facing forwards, with their palms also facing forwards and the thumbs out to the side. The knees and the feet are also directed forwards. We use the anatomical position to describe the position of structures relative to one another in the body, even if somebody is lying on the ground or standing on their head. The first terms that we're going to introduce are the terms superior and inferior. Superior means towards the head. So the eyes are superior to the mouth. An analogous term for superior is cranial. The opposite to superior is inferior or caudal, and this refers to structures located towards the feet. So an example would be that the nose is located inferior to the eyes. The next set of terms that we're going to come to are anterior and posterior. The terms anterior and ventral can be used interchangeably, and these refer to structures towards the front of the body. So the sternum, or the breastbone in front of your chest, is located anterior to the heart. That's an example of the use of the term anterior. The opposite of that is posterior or dorsal, and this refers to structures towards the back of the body. So the spine, or your vertebral column, would be described as being located posterior to the heart. So the spine is posterior to the heart. Whenever a structure is located towards the midline of the body, if you imagine an imaginary line passing right through the middle of the body, we call that the midline. Any structure located towards that midline is described as being medial. So in the hand, the little finger is medial to the thumb because it's located closer to the midline in the anatomical position. The opposite to medial is lateral, and this refers to structures located away from the midline of the body. So if we look at the feet now, in the anatomical position, the little toe is located lateral to the big toe because the little toe is located further from the midline compared to the big toe. The next set of terms are the terms proximal and distal, and we typically use these for describing the location of structures in the upper limb and the lower limb, because the terms proximal and distal refer to the location of structures relative to where the limb joins onto the trunk of the body. So proximal refers to structures closer to that attachment of the limb to the trunk, and distal refers to structures located away from that attachment of the limb to the trunk. So in the upper limb, the shoulder is located proximal to the elbow. It's closer to where the upper limb is attaching onto the trunk. In the lower limb, the feet are distal to the knee because they are located further from the origin of the limb to the trunk. Thank you.